Not surprisingly, Omicron seems to be taking the lead in new COVID-19 infections locally. Although its presence has not been confirmed through testing, Health Minister Dr. Frank Anthony has noted that health experts are monitoring an alarming upward trend in new COVID-19 cases, which suggests that the variant has landed in Ghana.
We have noticed from the 28th, when we last on the 28th of December, we saw 32 cases. By the 29th of December, that went up to 87 cases. Then on the 30th, that jumped to 161. And by the 31st of December, that went up to 182. So we start closing the end of the year with cases going up. And then on the 1st of January, we saw that went even further to 209. Then yesterday it was 284.
Last week, Dr. Anthony positively asserted that the variant was not in Ghana since there was a significant decline in new cases. He informed that once a steady increase is identified in the country's caseload, then samples would be sent abroad for testing.
We have mechanisms in place that when we have such suspected cases, that we'll be able to take those samples and send them to a lab that would be able to do the sequencing. So we have those arrangements in place. At this point in time, we don't feel that we have Omicron, but we still have a lot of Delta cases.
However, during his COVID-19 update on Monday, he failed to indicate whether samples will still be sent for testing. Instead, he cautioned persons to follow the COVID-19 emergency measures as cases are expected to soar even higher.
Keeping safe distances, we need to practice that. Wearing masks, we need to do that as well. A lot of people, they have the mask on, but the way that they use it, it's not going to protect them because they have it under their nose, they have it under their chin, they're exposing their nose and mouth, and that's not going to really help in preventing them from getting infected. So we need to wear masks and we need to wear it properly.
The Ministry of Health has established 3 partnerships for variant testing, an arrangement with the Caribbean Public Health Agency in Trinidad and Tobago, and another with the Pan American Health Organization, as well as the Icahn School of Medicine. Results from the first set of 10 samples sent in January 2021 failed to indicate the presence of a new variant in the country. Later that year, an additional 50 samples were sent and the Delta variant was detected, the minister confirmed last December. A recent study by the Centers for Disease Control and Prevention shows that 5 patients who were reinfected with the Omicron variant experienced fewer recurrent symptoms, including loss of taste, none, loss of smell, none, and subjective fever, 2, compared with symptoms reported during their first infections. Omicron has been detected in over 80 countries. Dr. Anthony added that the duration of the Omicron variant is shorter. Temika Rodney reporting for the HGP Nightly News.